I am with Dr. Gabor Maté, and you very kindly said, don't call me Dr. Maté. Thank you, Gabor, for agreeing to speak to myself and for this conversation of ours to be recorded straight away. We haven't spoken ever before, and we
Oh,
just connected 2 minutes ago, and you said, no, we'll find out about each other. So I like that. I like that openness there. And I don't need to introduce you. You are no stranger to the world, especially in the world I work in, which is the world of mental health, and in general throughout the world. You're very well known as a trauma expert. So it gives me great pleasure. And I was also telling you, I felt so grateful. You could have said, no, thank you, Rani, I'm not interested in talking to you. And he said, yeah, let's jump for the call. And that to me says something about you, the human being. And despite everything else, like how you're known, that human, that Gabor is a human being, and that itself, like, that stood out for me just by you saying yes.
no, but thank you. It's also opportunism on my part because I'll seize any opportunity, especially if I can speak to colleagues, because I think that the medical world, the psychiatric world in general, the medical world, or the psychiatric world specifically, but the medical world in general, for all its knowledge and insight and achievements, fundamentally misunderstands the nature of health, the nature of illness, and the nature of human beings. And that's not the fault of an individual. It's more like an ideological set of blind spots that we have. And so any, not that I'm right about everything, but any opportunity I get to be in conversation with colleagues, I really welcome. Because we every time I speak to one physician, I'm speaking to hundreds of patients.
Yeah, no,
So
absolutely.
for me, it's an opportunity for which I'm grateful. So thank you.
Oh, thank you. And as preparation, I did ask quite a few people in my network, like, hey, I get this opportunity to speak to Gabor, and if you were to speak, what questions would you have? And I thought that was fascinating, some of the things that came up. But most people said, we don't have a question. I don't have, some people said, I don't have a question for Gabor, but please thank him on my
Mm,
behalf because
mm,
his work has made a huge impact in my life, and I wanted to convey that right at the beginning that your work has made a huge difference to many people, some of whom you will never know,
yeah, yeah,
many,
yeah.
and yet people have been impacted. So let's talk about, you said when I use this opportunity to speak to a colleague, and we both have been trained in the traditional paradigm, and most people would agree that although we call it a health service, and in the UK it's the NHS National Health Service, most people would
Yeah.
admit that actually it's illness service, right?
Yes.
And we are not looking at health per se, although that's always there, and we might call ourselves health practitioners. But what we are
Mhm.
looking at and what we are really good at is trying to sort out the illness. And so, what I would ask you right at the beginning is, what do you wish you knew right at the beginning? You have done so much now, and what do you think could have prepared you to be a really good physician without having to stumble across it by chance, for example, or by lived experience?
Yeah. For one thing, you mentioned health. Did you get a single lecture in medical school on health? We don't even have a concept of what health looks like. We imagine health is the absence of disease. So we learn about disease. So, no, there's nothing wrong with that. And of course, we need to be trained to understand disease and to minister to people who are ill. But surely we should do that with the concept of health, number one.
Yeah.
Number two, the very word health comes from now in my native Hungarian, health literally means wholeness. Literally, it's the same word for both of them. In English, the word health also comes from a word for wholeness, which means that, properly understood then, illness represents a kind of lack of wholeness. So then, I wish people had told me where people lose their wholeness. What are the influences, impacts, developmental factors that interfere with people's connection
Mm.
to themselves? Now, Socrates, 2,500 years ago in ancient Greece, said that the problem with the doctors of today is they separate the mind from the body. He said this 2,500 years ago. In 1872, Darwin wrote that about the connection between the brain and the heart by means of what was then called the pneumogastric nerve or the vagus nerve. And he said that when there's a perturbation in the brain, that'll show up in the heart. If there's a perturbation in the heart, that'll show up in the brain. He's talking about the unity of brain, mind, and body. Many great medical pioneers have recognized this. Modern science has completely validated that human beings are what has been called bio-psycho-social creatures, which means that our biology is inseparable from our psyche, from our psychic apparatus, from our limbic system, and from our social relationships, and that begins in utero. And nobody teaches you this in medical school. We learn physiology as separated from people's lives and people's emotional dynamics and people's relationships. So that's the second thing I wish they taught me. The third thing is, and especially when we talk about psychiatry, and psychiatry, modern psychiatry tends to be very biologically oriented, looking at the biology of the brain, and everything is a matter of imbalance of this chemical or that chemical. So let's balance them by means of medications. But does anybody ever teach you in medical school how the brain actually develops? If you actually look at the brain science of brain development, to quote from an article from Harvard University, 2012, the brain develops to a complex interaction that begins before birth and continues into adulthood and is heavily influenced. So it's actually the environment acting on the genes. And the most important influence is the relationships of the child to the nurturing adults. In other words, when we look at the physiology of the brain, we're looking at the impact of life experience. And most physicians are not asked or not taught to ask about life experience. I'm telling you, I've seen psychiatrists who have no idea how to take a childhood history of what actually happened to somebody. And one more point to complete my answer. When I was in medical school in third year, we took neuroanatomy. And I had to learn all those 6 or 7 projections of the habenulo interpedicular fasciculus, whatever that is. And I spoke to a practicing neurologist. And I said, look, you're a neurologist. How much of what I'm learning in neuroanatomy do you even use in your specialized practice? He says, maybe 15, 20%. But I spent the whole year learning in great detail about neuroanatomy that not even a neurologist needs to know. So it's not a question of lack of time. It's a question of lack of priority. So we prioritize these meaningless, often meaningless physiological facts, and we neglect the social, emotional context in which all that brain and the mind develops. So that's all I wish they taught me all that.
That is beautiful. And there's definitely a deeper understanding, maybe not amongst everyone, but amongst most people, because of pioneers such as yourself, and most mental health services now would even use the word trauma informed.
Yeah.
Whether it is, I don't know specifically what they mean by trauma informed. Oh, we know this, but are they embedding trauma informed practices? Another matter.
Yeah. That's an interesting phrase, trauma informed. Because sometimes programs or institutions will describe them as trauma informed. What's the opposite? Trauma uninformed? There should be a sign on the institution, most general hospitals or many psychiatric clinics, there'd be a sign saying we are trauma uninformed, because that's the reality. Now, what does trauma informed means? It means recognizing the central importance of trauma as a significant, not the only, but as a significant and often neglected contributing factor to the onset of illness. And I maintain that's true for physiological illness, all illnesses, but what we call physical illness, from multiple sclerosis to autoimmune diseases like rheumatoid arthritis to malignancy. Social emotional factors often play a significant role, demonstrably, scientifically proven, but certainly when it comes to mental illness, there's no understanding of mental illness or what we call mental illness without understanding trauma. So
Mhm.
trauma informed at least means that we know that trauma has played a role here. And even if I'm not trained in helping people resolve their traumas, at least I'm informed enough to know that it's present, and I'll send you to somebody who can deal with your trauma. So if you come to me for depression, for example, for which I've had treatment, I've taken medication with benefit decades ago. But if you look at the word depression itself, what does it mean to depress something? It means to push it down. That's what the word means.
Mhm.
So what gets
Suppressed.
pushed, what gets depressed in depression are emotions. So you have a flat affect.
Mm.
Why would somebody push down their emotion? Guess what? At some point they get the message that if they express their emotions, they'd be in trouble, usually in early childhood. That's a trauma.
Mm.
So that no, that doesn't mean that medications can't help. They help me temporarily, but beneficially. But they don't deal with the underlying pushing down that happened as a result of trauma. So trauma informed means that even as I give you the medication, if I need to, and sometimes you don't, for your mental health conditions such as depression, I'm going to make sure that the trauma itself is also addressed. So that's what trauma informed means to me.
Are you happy for me to be like a play the devil's advocate because I remember someone's question
Yeah,
here. So before that, I guess what I'm saying is like there could be also a spectrum, isn't it? Because the expansion of trauma does not mean the big events where we say leads to PTSD. It could also
yeah,
be the small events. Did you
yeah.
want to say something?
No, complete the thought. Go ahead.
Yeah, yeah. So that's there. And you know what I think about? I know I've been very lucky to have the childhood I had. If I were to compare, like I had quite a normal childhood, what people would call normal childhood. And there was nothing major adverse effects I had as I growing up, but I still had some trauma, like small traumas. And I know for a long time I assumed I was not good enough. I assumed that everyone else was better than me. And
Yeah.
someone could look back and say, but Rani, don't be silly. There was nothing in your
Mm.
childhood. And even now, my rational mind, it didn't make sense. But for a child, it was traumatic. And I know this is why I really got fascinated in the holistic world.
Yeah.
This is why when I came to England back in 2001, I knew that I was a doctor. So people would think, oh, Rani has got everything sorted. But I'm a human being too. So I knew that I also had this, like the persona of, yes, I'm a doctor, but I had this lots of low self-esteem, and I went down the healing journey of really exploring what there is, and then I became a coach. But that what was fascinating was that in some of my one-to-one sessions I had with, say, for example, a EFT, you might have heard of EFT, emotional freedom techniques, therapies, I released some trauma. I didn't even know it was so painful, but it just came out of nowhere. So there was this energetic shift in me. So
Sure.
I really get what you're saying because to the public, it's, oh, Rani is not, never has been traumatized, but the little child was traumatized in her own way. So I can relate to what you're saying because I had those experiences myself. But then
Sure.
I also remember a question where they said that does everything have to come under the umbrella of or the word of trauma? Can people not have mental health issues without any trauma? So how would you answer that?
Yeah. First of all, let's go back to your original assertion about how, compared to other people, you had a pretty good childhood. That's not a helpful way to look at anything. I'll tell you why not. If a 3-year-old comes to you and says, my foot is hurting, would it be helpful to say to him, what are you talking about? Think of all the children who've lost their limbs in war. What are you complaining about?
Mm,
So you don't compare pain. Pain is an individual subjective experience. and it's genuine. So comparing it just doesn't work. Number one.
Mm.
Number two, the word trauma itself, before I give you my answer to your question, does everything come under the umbrella of trauma? Let's understand what trauma means. And often when people talk about trauma, they think of terrible events, such as you've talked about. So it could be war or poverty or racism or on the individual level, physical, sexual, or emotional abuse or a parent dying or a bad divorce or violence in the family. Those are what we call the big, but those are not the traumas. Trauma is not what happens to you. Trauma is what happens inside you. Trauma literally means a wound. And that's the Greek meaning of the word trauma. And you were telling me that you were reading my most recent book, The Myth of Normal, which I'm not ashamed to show people. Thank you
Yeah.
very much. And the first chapter is just about this. So trauma means a wound. And so the wound is not what happens to you. The wound is what happens inside you. So let's take the example of a blow on the head. That's not the trauma. The trauma is the concussion. If I get a blow on the head, but I don't have a concussion, then I wasn't traumatized. So the trauma is what happens inside you. That's the first point. The next point is, yeah, there are those big T traumas, such as those terrible things that I mentioned, but then the children can be wounded in other ways. And you can wound somebody not just by doing bad things to them, but by also not meeting their needs. Now, children are born with certain nature dictated needs. And one of them is for unconditional loving acceptance. So you somehow got the message that you are not good enough. And by the way, a lot of doctors get that message. I did. And that's one of when we talk about why we go to medical school, we can tell ourselves all kinds of nice stories and they can be true. Like I'm sure that you wanted to be a doctor partly because you wanted to help human beings and alleviate suffering. So did I. But part of me also wanted to validate my existence and to be important. That's the unconscious part. And if
Mm.
you want to be important, you know what you do? You go to medical school. Then you'll be important. That can be very addictive, of course. So what I'm saying is that your trauma was not necessarily that terrible things happened, but your needs for unconditional love and acceptance was not met. And that wounded you. And the more sensitive you are, the more that will wound you. And then you can achieve all kinds of wonderful things in the world and still have very low self-esteem. Because genuine self-esteem doesn't say, I am worthwhile because I can do this, that, or the other. Genuine self-esteem says, I'm worthwhile whether or not I can do this, that, or the other. And so, to answer your question, yeah, in some very rare cases, and I can't think of too many, mental health condition might be purely genetically derived, but those would be like vanishingly rare. Or it could be the result of physical poisons, who knows? But that would be vanishingly rare. But in most cases that we deal with, whether it's depression or psychosis or attention problems or anxiety or self-cutting or eating disorders, we're talking about trauma. And there's a British psychologist who said that the link between childhood adversity and adult mental health problems is as clearly established as the link between smoking and lung cancer. And so that at least in our history taking, we at least have to deal with the issue of trauma. But we can only deal with the issue of trauma if we understand it. And again, when you went to medical school, wherever you went to medical school, how many lectures on trauma did you receive? Not one. And yet it's a major factor, uncontroversially, if you look at the scientific literature,
Mm.
in its contribution to mental health issues from addictions to anxiety to everything else. So we're just not trained to actually deal with what's out there.
Yeah. So I'm thinking of how when I was a junior doctor in psychiatry, we had to look at causes of mental illness. And we were given this we had to do the columns and rows, and then
Yeah.
biological, psychological, social, predisposing factors, precipitating factors, and perpetuating factors.
Okay.
And so anyone, if there's a psychiatrist or a health professional or healthcare mental health professional listening, they'll say, but yeah, we do this. Yes, of course, we look at biological, but we also look at psychological. This is why we have psychologists, and psychologists do an assessment. They do talk about early child ACEs and so on. And then, of course, we also look at the social environment. We also look at the family situation. We look at the environment they are. So in a way, we are already doing this, and we have looked at predisposing factors, and of course we know that happen. And so whatever you're saying, Gabor, we are already doing in a way. So what would you say to that?
Well, first, I don't think we're doing it. We might be paying lip service to it, but I don't think we've absorbed the actual essence of it. And I don't think in our minds we get the deep connection between early childhood experience and adult outcomes. And I don't think we get the degree to which dealing with those traumas is essential with resolving mental health issues. So we might get certain information, and obviously we're talking about all kinds of variations from one practitioner to the next. But I don't think it's a systemic fact. It's true that we get it. I don't think we do. And look, part of the reason I developed my own interest in all these issues is I was a family physician. And I began to notice, I'm talking about Canada. And as a family physician, I began to notice that who got ill, whether we're talking about mental health conditions or physiological health conditions, chronic illness, there were all kinds of personality and emotional factors that were playing a significant role. And once I realized that when somebody comes in with rheumatoid arthritis, it's not enough for me to give them anti-inflammatories or steroids or immune suppressants. I also have to deal with the emotional self-suppression that's often the template for rheumatoid arthritis. In fact, not just according to me, but according to all kinds of studies. But then what do I do with my patients? Well, I send them for counseling, except my patients couldn't afford private psychologists because I wasn't working in a wealthy area. And the psychiatrist simply did not have the equipment to deal with this stuff. Psychiatrists that I knew, I don't know how to say this without sounding arrogant or dismissive, and I'm not trying to be, but I realized there were two kinds of psychiatrists, those that were good and those that were available. And the ones that were available were not good, and those that were good were not available. And because the ones that were good, they took on clients for a long time for deep emotional work. And the ones that were available tended to be the biological ones who said, you got depression, here's Prozac, thank you, call me in a month. So I don't think in practice. So then I said, okay, somebody's got to talk to these people. So I started talking to my patients or with them. So it's not my experience. And honest to God, when I hear about the National Health Service in England, I hear from so many people, both doctors like yourself or patients, same in Canada, North America, people are left bereft of any trauma-informed support. So you may tell me that in your training you covered those bases, but I don't think there's an integrated, practical manifestation of that awareness. I don't think so.
Yeah, and I'm also thinking, listening to you, I'm wondering why. And one thing that comes to me are, again, say, for example, mental health professionals. When you think about the word, even the word mental health professionals, is we are the professionals and we will help you, those who come to us with your mental health. And then the term that comes to mind is wounded healer.
Yeah,
How many healthcare professionals, and I'm talking about mental health care because I'm mental health professionals, have had their own trauma of some kind, and they
yeah.
had to park it or leave it at home and then show up and try to serve the patients. And I'm wondering whether that also gets in the way of really going there because you haven't dealt with your own as a
Well,
possibility. I'm not saying that's true, but I'm just saying as a possibility.
no, but I think it is true very often. It's my observation. I'll tell you a funny story. Sometimes I worked with plant medicines, and once I was helping to facilitate a plant medicine ceremony, and this guy comes up to me before and says, I'm just one of these crazy psychiatrists. And I said, don't worry about it. I said, there's two kinds of psychiatrists, those that know they're crazy and those that don't know they're crazy. And the ones who don't do a lot of damage. because we talk about, even our language, symptom control. Look at that word, symptom control. We're trying to control things rather than dealing with causes, number one. Number two, we're trying to control things in other people that we haven't dealt with in ourselves. And I think, again, there's all kinds of beautiful reasons to go into healthcare, including psychiatry or any form of medicine, part of which is just a desire to help and to have meaningful work. But part of it is the unresolved parts of ourselves. And there's nothing in medical training that, for the most part, asks us to deal with that stuff. As a matter of fact, we're considered wimps and weaklings if we have any problems at all. And I'm not a believer in psychoanalysis. Freudian psychoanalysis, I think, had a lot of sins to make up for. But they did demand that any psychoanalysts have to undergo analysis themselves. In other words, the ethic of we have to deal with our own stuff was at least recognized. But whatever one thinks of psychoanalysis as a discipline, at least they recognize that you have to deal with your own stuff. And I know that. And one more thing, when I was working with a highly addicted population here in Vancouver, I never had any drug addiction problems or even temptations for that matter, but I certainly had addictive behaviors in my life. And in dealing with these highly addicted, substance-dependent individuals, I could see myself in all of them. I was much more fortunate that they were, but the addictive drive, the need to escape, the dishonesty, all the manifestations of addiction, I had them. And so in the myth of normal, I talk about 5 levels of compassion. And one level of compassion is the compassion of recognition, where you're not this, yeah, you are professional things and you have responsibilities and you have capacities. That's true. At the same time, on a human level, you're not any higher than anybody that you're dealing with. And whether it doesn't matter who I was dealing with, whether it was depressives or people with anxiety or anything, I never met anybody that didn't to some degree mirror some dynamics within myself. And the sooner we recognize that and the sooner we deal with it, the better we become as practitioners, I think. And unfortunately, medical school puts tremendous pressure on people. Somebody once said, how do you build a cult? You give people a uniform, a jargon only they can understand. You sleep deprive them, you separate them from their families, and you put them under authoritarian leaders. In other words, you send them to medical school. And medical school is very stressful. Psychiatric training is very stressful because you're dealing with really troubled, traumatized individuals. There should be one aspect of medical training and psychiatric training that pays attention to the practitioner's needs. But that's often lacking, I think.
Wow. Yeah. So relate to everything you're saying. This is so beautiful. I wanted to say something, or I want us to explore identity. And I appreciate that just raising awareness of trauma is so crucial. And that brings the humanness to us, like knowing that you and I are no different. You and I know we are at a basic level, we are all human for sure. And we all had our own share of ups and downs, but there's something about labels I want to touch on. Quite a few people in my network talked about school children, for example, and they were saying,
About what, sorry?
school children.
Children.
Some children who might have been traumatized and they also then ended up with a diagnosis. And they were saying that they were also finding that some of the children, maybe not very young, maybe even adolescent, they also have this thing like, oh, this is who I am. That
Yeah.
trauma happened, and so in a way my life is doomed, or maybe this is how far I can go in life.
Yeah.
So one of the not criticism was like a question was that is it possible that when we go more towards, okay, you had trauma and then we validate trauma and people say, oh wow, I am someone who experienced a lot of trauma in my life, not just one event, but multiple events, for example. And this is the diagnosis I've been given, whatever the diagnosis is. And could it also, do you think it might also limit people rather than liberate them in some ways?
that can, and I need to answer your question on a number of different layers. First of all, let's look at the word identification that you began with. It comes from the Latin, idem, the same, and facere, to make. So when you identify with something, you make yourself the same as. And I'm just reading totally by the by, but I'm reading the Hindu epic, the Bhagavad Gita. And it talks about one of the levels of the mind, which is called ahamkara. Aham means I, and kara means maker. So the I maker, what I identify with. And most of our identifications are unconscious. We don't even know this, but they govern so much of our behavior. So if I identify with my diagnosis, then I'm making myself the same as the diagnosis. That there's no separation. There's no I that's not limited or delineated by the diagnosis. First point. Second point is diagnoses don't explain anything. So I get this from a British psychiatrist, but it's so brilliant. So I've been diagnosed personally with attention deficit disorder. It was a subject of my first book, Scattered Minds. And I used to, initially I thought this explained me, but it doesn't. Because let's look at it. The diagnostic features, amongst the diagnostic features of ADD is ADHD, if you like, attention problems, difficulty concentrating, absent-mindedness, poor impulse regulation, and sometimes hyperactivity, fidgetiness. Okay, so Gabor has ADD. How do we know? Because he's got a tendency to be absent-minded, to tune out. He's had poor impulse regulation, and he tends to be fidgety. Why is he fidgety? Why does he have impulse regulation? Why is he tuned out? Because he's got ADD. How do we know he's got ADD? It's totally circular.
Mm.
It's not an explanation. It's a description. And I could go through any psychiatric diagnosis and make the same case. So psychiatric diagnoses don't explain anything. They just describe certain traits, behaviors, ways of mental functioning. They don't explain a thing. So that when you identify with a diagnosis, you're identifying with the description, but not any kind of underlying reality. The third point is, let's go back to what I said about trauma. Trauma is not what happens to you, it's what happens inside you. It's a wound. So trauma is not what happened to me in my infancy, but what coping mechanisms and defense mechanisms I develop and what self-beliefs, such as yours in lack of self-worth, what self-beliefs you developed as a result of those events. So trauma is the wound that hasn't healed. Well, that's a good thing. Because if trauma was what happened to you, Rani, in your childhood, it's hopeless. It happened. It'll never not have happened. But if trauma is your dogged self-belief and your lack of self-worth, or if trauma is my coping with my emotional pain by tuning out, that can be healed in the present. So rather than the diagnosis being a limiting factor, it can point to the wound that can be healed today. So, to answer your question, can it be a limiting thing? Yes, if you identify with it. Whether, and in the case of children, whether the caregivers identify the child with that diagnosis, or whether they see the diagnosis simply as pointing to some underlying dynamics that in the present can be healed. So it need not be limiting, it can be liberating, depending on how we relate to it.
Yeah, and where we point people to
Exactly.
yeah, you remind me of I want to mention his name and I would love you to connect to him at some point. His name is Dr. Bill Pettit. He's a psychiatrist in the US. He has
Mm.
been my mentor for several years now. He has a
Mm.
quote I absolutely love to quote all the time, and his
Mm.
quote is that a diagnosis does not is not about who you are, but where you are. Being like the symptoms are basically
Exactly.
yeah,
Exactly.
yeah. So I just love it. It's a so powerful distinction. It's not who you are, it's where
Well,
you
you know
are.
what? I'd love to find a quote on my cell phone. I dictate all kinds of quotes from medical texts, from books, even whole books, and anyway, here's a quote by Oliver Sacks, the British-born American neurologist and writer. And it's so much to what you just said. And he's writing to a woman who was diagnosed with bipolar disorder. And here's what Oliver Sacks writes to her. What seems to me less stressed and most in need of stressing is that you are an individual, unique in gifts, with gifts in genes, which no one else in the world exactly duplicates. And that means you have a true place and a role in evolution and in the present. That you have bipolar disorder is in a sense, are bipolar, does not begin to encompass the whole of you. It is a what, while you have to hold on to this sense of personhood. So it seems to me Sachs and your mentor are saying exactly the same thing. And it's so true. And we forget that too easily. Somebody walks in with a What's interesting, of course, is as you notice in the psychiatric world, if you're in the world long enough, you'll accumulate a whole set of diagnoses.
Mm,
And depending on but when somebody walks in and you look on their file and you look at their diagnoses and you think that's who they are, you're not seeing the person.
yeah. Oh, yeah, totally. I remember when I was a rehab psychiatrist a long time ago in NHS, we used to go to locked units to assess people to bring them back to our county. And I
Yeah.
would have to, as a consultant psychiatrist, I would have to read all the reports and everything. And already in my mind, I
Yeah.
form a mental picture of how they're going to
That's
present and so on. And then I meet the person and I said, are you the same person? Like sometimes all the reports seem doom and gloom and so much negative, and I think generally I'm connecting to the human here, and sometimes I think it's a disservice we do when we read too much about people's past, and then because we come with an assumption in the
Yeah.
present and don't even give a chance sometimes to people because we are already thinking, oh, but I'm already, for example,
That's right.
forming formulations in my mind of them. Wow. So that came to me. And oh, a term I read in your book, they were you talking about remission, but also radical remission.
Yeah.
And I see that you spoke to the writer and
Yeah. Kelly Turner, Dr. Kelly Turner.
yes, and also Anita Murjani.
Yeah, I've talked to Anita as well.
Yeah, and clearly their healing was like it's not something medical science would say. Like it's a miracle,
Yeah.
right? When
Yeah.
doctors
Yeah.
have given up and so on. And there was something very like the healing happens at a very deep level than health professionals can ever anticipate. I want us to now change gears a little bit to talk about healing because you have a beautiful chapter on healing. I was fascinated by. Okay, so this is the trauma. This is like
Yeah.
this,
Yeah.
and where do we go from here? And you had the 4 A's. But talk to us something about the radical remission.
Sure. So Kelly Turner is an American oncological psychologist, and she studied cases who with malignancy who got better despite the failure of medical treatment or despite the refusal to get medical treatment. And these are the cases that we call spontaneous remissions. And there's a Dr. Jeff Rediger from Harvard, who's a psychiatrist actually, who's also written a book on a similar subject called Cured, the science of spontaneous remission, something like that. So they both studied these cases where there's documented terminal illness and then people get better. And I've always thought that these are the cases you should be studying, not the cases where people get better without treatment or they get worse or they don't get better, but they get better despite or without our treatment. Then maybe there's something to be learned here. Now, take a very famous British example, and I talk about him in my book, When the Body Says No. I'm having an old age moment here. The great physicist who had ALS. Come on. Okay, give me a sec.
Okay.
It'll come to me in a minute. One of these moments where a name is not popping into my head, but it'll come to me in 1 second. Yeah. Stephen Hawking.
Oh
Yeah.
yes.
Yeah. So Stephen Hawking was diagnosed at age 20 or so with ALS. He was given 2 years to live. Guess what? He lived five more decades and became one of the greatest physicists in the world.
Yeah.
Now, these are the cases you should be studying. And what both Kelly Turner, who wrote Radical Remission, and Jeff Rediger, who wrote on a similar topic, found that there was nothing spontaneous about these remissions. That these people all they took on different diet, they exercised, supplements, whatever they meditated, whatever they did, but the essence of it is that they developed a sense of agency, which is a total switch from their previous personality. And they all say, I wouldn't want to be the person I was before. In other words, they allowed the disease to teach them something about connection with self and agency. And that's the key factor. And here's what I can tell you. And I've seen so many examples of it. Doctors will say it's anecdotal. Yeah, it's anecdotal. I believe in what I see. Okay. I gave a talk in London 6 years ago now on people that develop autoimmune diseases being people who are emotionally self-suppressed as a result of childhood trauma, who are people pleasers, who don't know how to generate healthy anger to protect their boundaries, who take on responsibility for other people's emotional needs. These are typically, and not just in my experience, but in the literature, these are the traits of people that developed autoimmune illness. I won't go into the physiology of it now, but it's very straightforward, actually. But I gave this talk in London. There was a young woman there whose first name is Valentina. I talk about it with her permission. She had lupus. She had the typical butterfly rash of lupus, the big redness on the cheeks, the bridge across the nose. She had Raynaud's phenomenon. Her fingers were almost yellow. They were yellow as chalk because of the deprivation of blood supply. She was told that you got this autoimmune disease. We don't know what causes it. There's no cure. You'll be on medication for the rest of your life to control the symptoms. Guess what? She dealt with her traumas. She began to assert herself, developed a sense of agency, became more whole psychologically. For years now, she's been symptom-free, no medications. She has a child now. She's totally healthy, vigorous, thriving. And I know many such cases. And Jeff Rediger and Kelly Turner and others have described others. In other words, not that we're promising a magic cure to everybody, but we are saying that a sense of agency and dealing with traumas can profoundly affect your physiology. And whether we're talking about the physiology of the rest of the body or that of the brain, so that we ignore these factors at our peril. And I'm not saying we should discard or in any way dismiss the wonderful achievements of modern medicine. My God, it's miraculous. But we're missing a huge piece, is what I'm saying, which is the wholeness of the person.
Mm.
And what if we actually brought that in combination with the wonderful pharmacology and technology and interventions that we're capable of generating? What if we combine that with a genuine holistic awareness of human beings? We could do so much more, and it could actually become a national health service.
Yeah. Yeah, and when you talk about a sense of agency, what's coming to me is that you can't give it to someone. You can guide them. It needs to come from within.
That's
A-
right.
And in your books, you talk about the environment, but you also definitely talk about not just the external environment or environment about the past, but inner environment. So I'm hearing agency, ownership as like the strengthening of the inner environment, so to speak, to take back that. So I know our time is limited, but I would like us to talk about what you think, because you talked about clearly there's a mind and body connection, you said. We can't separate it. And
You
I
know
would say
what?
many people,
Sorry to interrupt,
yeah,
Ronnie.
sorry,
I don't even talk about a mind-body connection.
do you not?
And the reason I don't is because there's an assumption there
Right,
that two separate things are connected.
right.
It's mind-body unity.
I
And
see.
And as the great American researcher, scientist Candace Pert, she actually coined the word. She's the one who discovered the endorphin receptors.
Yeah,
And in her book Molecules of Emotion, she talks about body mind, body slash mind. So it's not a connection.
yeah, yeah. But no, thank you for clarifying that. I want to bring in the
Yeah.
spiritual into it, and I think you're coming to the Masters event this time in the UK, or you
Mhm.
might, and then this time the topic is spirituality.
Yeah.
I want to hear your views about spirituality because to me, from where I am and in my own my own inquiry, self-inquiry, my own journey into looking at my doing all my inner work is I really see in my view, humble view, is like what I think is missing in mental health is we talk about that mind body will connection and some people would even call it unity, but you have described it beautifully.
Yeah.
But to me that there's also that we are not addressing the spirit, or let me even be brave enough to say the soul, and we say, oh, that belongs to church or the chaplain. And I still remember it uses a tick box. In some places, in some NHS services, they have this tick box that we have to do. And I also see that there's a box called spirituality, and most people just think, oh, that person does not have any religious views or not spiritual.
Yeah.
And I also have seen that many people in crisis, at this in psychiatry, they have some kind of existential crisis at some point,
Yeah.
and that cannot just be soothed by medication, by giving psych drugs or just talking about it necessarily. So I want to get your views about mind, body, spirit connection or unity.
Yeah, sure. There was the great American internist and psychiatrist, George Engel, who in 1977 said that people are biopsychosocial creatures. So we've talked about that. He didn't mention spiritual. Okay. But then if you look at the healing practices of indigenous people in North America, there's this concept of the medicine wheel, which has four quadrants: the physical, the mental, which includes our thoughts and our emotions, the social, and the spiritual. So what is the spiritual? The spiritual is not a set of beliefs. You can be totally religious and be totally non-spiritual. Or you can be non-religious and be spiritual. Non-religious in the sense of belong to an institution or ascribing to a set of beliefs. Or you can be religious and spiritual. But the two are by no means identical. So look, you're talking to a non-religious person, and I'm not somebody who's had deep spiritual experiences. I know people who have, I haven't. I don't believe in afterlife or previous lives, any of that stuff. I don't argue with people who do, but I'm reading the Bhagavad Gita, which is all about reincarnation. I don't, okay, not for me. But I understand spirituality is that we are part and parcel in the manifestation of something much greater than we are as individuals. And part of our challenge in the modern world is a sense of isolation from that wholeness, which includes nature, which includes the whole universe. And when you think about it, how would it be otherwise? At some point, nothing existed as far as we understand, if there's a concept of nothing. And then there's this big bang, and all of a sudden, matter comes into being. And at a certain point, that matter coalesces into this little globe called the Earth. And at a certain point, some aspects of that matter take on life. And at a certain point, that life begins to evolve and you end up with human beings. Well, when did we lose our unity with all that? We're still manifestations of, it's like the Bible says, from dust to dust. So that it's a total illusion that we're separate creatures.
Yeah.
And one of the toxicities of this culture is that it magnifies the illusion of separateness
Mm.
rather than the sense of unity and oneness. Spirituality to me is a recognition of us being manifestations of and belong to something much greater than our individual physical or psychological selves. And some people, I'm not amongst them, have had direct experiences of that unity. I haven't, but I know it. How would it be otherwise? So spirituality is looking beyond the artificial boundaries of the self. That's how I understand it. And yes, for some people, a health crisis will instigate a deep inquiry into their psychology, which is good, but also it'll instigate a spiritual journey. And I don't think the one with the other is sufficient, to tell you the truth. The spiritual journey without a deep psychological inquiry, I think, can be a bit of a bypass.
Mm.
At the same time, if it only stays on the psychological level, we're missing something essential.
Yeah.
So ultimately, to embroider on George Engel, we're biopsychosocial spiritual creatures.
Beautiful. And I definitely fall into the camp where I'm not religious, but
Yeah.
I'm deeply spiritual. Even as a child, I felt there was something bigger than me, and I had some, what some people would call spiritual experiences. But I'll tell you one thing, I think I said it in my email, and I'm on a mission to do my way, shift the paradigm in mental health, and I would like to just take this opportunity to share with you what I'm seeing at a deeper level. I think again, it's not
Mm.
just like I'm thinking it, I'm feeling it in my heart. And one of the things that sometimes people, some of my ex-patients when I was working in the NHS thought they thought they were broken because of the trauma that happened, and in fact they were treated by well-meaning practitioners as, oh, but I say someone even used the term damage good. And I really felt for that. Wow, like that's more sympathy rather than compassion, or in a compassionate recognition, like you were saying. But I say what I'm seeing is I call myself a holistic psychiatrist because I have done my own personal journey alongside training to be a psychiatrist. And I'm so grateful that this path is, oh, it's all, we are all the same. We are all the same. We all get caught up in our thinking, in our experiences, and we can make meaning, any meaning out of that. And until our consciousness shifts and we see something else. But what I have been saying, and tell me what you think about this, but in the traditional mental health paradigm that I've been trained in, the main question we ask is what's wrong with you? Okay,
Yeah.
so what's wrong with you? Let's diagnose you and then let's fix you, let's treat you. And then there might be a role for that in the short term when someone is really unwell and suicidal, and so they have to be contained. But I think it's not sustainable, or it does not lead to true healing in my view. And so I find that the trauma, what people call trauma-informed paradigm, is definitely an upgraded version, more compassionate and definitely much needed, where the most important fundamental question you're asking is what happened to you. So we are not like focus on your diagnosis and making you wrong, but we want to understand where you've come from. And to me, that's amazing, and that's definitely the step in the right direction. And
Yes.
sometimes that my question was like, some people then get caught up in, oh, maybe I can't heal anymore, or maybe there's a limit. So the term that I love that I've come up with from my seeing is, I call it mental wealth paradigm. Yes, it's really important to support you and look at what happened to you, but let's explore what's already within you.
Yeah.
That to me is the mental wealth. So we are looking at their sense of agency, like you're talking about, how can remission happen despite whatever happened to them in the past, and for really them to tap into that, the oneness of life, like you said, and get the resilience from within, despite the environment not being perfect. And I wonder what you think about that.
I think along the same lines. First of all, the question, what's wrong with you, could be reframed. I think more usefully is to say, what's not working for you,
Mm.
which is a totally different question.
Love it.
Number one. Number two, I don't see anybody as damaged goods. Let's take one area where I've worked extensively, addictions. So what's the word that we use when we say that somebody has healed from an addiction? What's the word that we use?
Recovered addict, some people use that.
Recovery. Okay, very good.
Yeah.
No, I used to be an English teacher, so I pay attention to language. What does it mean to recover something? What does it mean to recover something? I'm asking you.
What does it mean to recover something?
Yeah.
Recover something is to discover or find out something that was like
No,
hidden.
no, discover is to find out something new. What does it mean to recover something?
Uncover,
It means to,
find again.
no. When you talk to people, what did you find? when you recovered. You know what they say? I found myself. In other words, that self was never destroyed. It was never damaged goods. It just got covered over and layered over, disconnected from.
Yeah,
So that if you look at the word healing, it means the recovery of wholeness. And that means nobody's damaged goods. As long as there's consciousness, there's the possibility of that recovery.
yeah,
That's what healing means. And as to the question, what happened to you? There's a wonderful book by Bruce Perry, a great psychiatrist, along with Oprah. It's called What Happened to You. It's a wonderful book. But I want to just emphasize that what I said about trauma in the first place, it's not what happened to us from the outside, it's what happened to us on the inside.
yeah,
And again, the good news is that if what's not working for you, to go back to the original question, has to do with the wounds that you sustained a long time ago and you're still carrying, then they can be healed in the present. So to explore it from the perspective that you've outlined, and I'm slightly rephrasing, is to hold out the possibility of wholeness and healing and yes, recovery. So that to look at anybody as damaged goods or to identify them with their diagnosis is simply an optical illusion
yeah.
with terrible consequences.
Yeah, yeah. Oh, this is such a beautiful and hopeful conversation. So, Gabor, to wrap this whole thing up, if you had any message for anyone who is struggling at the moment but watching this interview, watching us on YouTube or listening to this, but they feeling broken, they feel that they can't heal and they're just like wanting to give up because they have tried to explore so many healing avenues and were felt that they have got anywhere. What would your message of hope be?
I teach a course for health, mental health professionals called Compassionate Inquiry. And one of the principles I teach is, and somebody says, I feel broken, I'll point out to them, that's not a feeling. Feelings are, I'm tired, I'm hungry, I'm sad, I'm angry. I am broken is not a feeling. It's a belief. When you have that belief, you might feel sad, you might feel grief, but the statement I'm broken is not a feeling. It's a belief. And itself is a marker of trauma. The reason I make that distinction is I don't argue with people's feelings. If Rani, you told me that you felt sad, I wouldn't say no, you don't. But if you told me that I believe I'm broken, I'd say let's examine that belief and where it came from and what function it plays in your life. And what I would say to people is that every belief that you have, even the ones that are most self-defeating, it seems, has a source in your life. You weren't born with it. And that source can be discovered. And that belief can be understood and transformed. And most of the things that you think are wrong with you began as adaptations. And again, the title of my book is The Myth of Normal. And the point I'm saying is that what we call our abnormalities are not that at all. What they actually are is the normal responses to abnormal circumstances. So your anxiety, your belief in your brokenness, your scattered mind, your sense, your depression, these all began as normal responses to an abnormal environment. And you can transform all that given the proper help. Now, the difficulty is finding that proper help. And so many people are disappointed in that because, again, many mental health practitioners are not deeply trained in this stuff. So their capacity to help, their willingness to help is absolutely genuine. Their commitment is sincere, but they're limited by what they have not been taught.
Yeah,
I'm not going to recommend specific modes of therapy here, mine or anybody else's, but I'm saying your belief in your brokenness is only that. It's a belief. And that belief, you weren't born with it, and you don't have to die with it.
Beautiful. Thank you so much, Gabor, for your time. And if anyone has not read this book, I highly recommend The Myth of Normal. This is only one of the books. There are multiple books. Do check it out. But I can't thank you enough, Gabor. I felt this was a very special conversation, especially because I was able to ask you as an insider, someone working in mental health, seeing people with mental health distress and challenges, and also knowing what my colleagues, professionals, have struggled with. I hope listening to this conversation, watching us, will give people hope, not just as a professional, to explore this understanding more, but also for anyone who might be struggling with their mental health at the moment. So I thank you so much for your amazing work and for this beautiful gift to me and my listeners and audience.
Well, thank you for having me. It's a great pleasure to meet you. Take care.